You are listening to Go to Health Media. To reach Jonathan Marks or his guest expert, you may send an email to jonathanmarks@gotohealthmedia.com. You may also visit and subscribe to the website and show at gotohealthmedia.com. And now, back to this week's show. Okay, welcome back. This is Jonathan Marks for Go to Health, and we are talking today with Dr. Jamil Norman, PhD, RN, and CNE, a certified nurse educator. We're talking about the Black Maternal Health crisis and the upcoming week of awareness about this on April 15th through 19th, 2024. You can participate in this week of education at the following link, bit.ly/blackmomhealth. So Dr. Norman, thanks again for being here. Tell us about your background and how you came to this kind of work, what turns you on, what brought your focus to this. Tell us more about who Dr. Norman is.
Gosh, this takes me back to when I first started in nursing and I was in nursing school. And honestly, I did not want to be a labor and delivery nurse. I didn't want anything to do with pregnant women until one day I got pulled to the labor and delivery unit at the hospital I worked at when I was in nursing school. And I was not very happy about it at that time. I thought I wanted to go into cardiology. And I went on that unit and had the best night of my life. The nurses were wonderful. They let me come in and watch women labor. I got to go to a cesarean section. I got to witness the miracle of life when a child is born, and I was hooked. That was it. That was all I ever wanted to do in nursing after that. And when I graduated, I went straight to the labor and delivery unit and started working with pregnant women. And when I started working with pregnant women, I kind of thought back to my sister when she was pregnant as a teenager. And so we had a lot of adolescent patients that came in, and she shared her story of how she was treated whenever she went in to have my niece at that time. And she was treated very poorly. They weren't very kind. It was already a stressful time in her life. And that really made me want to be the best nurse, especially to my adolescent patients at that time, because I just didn't think anybody should be treated that way while they were pregnant. And so early in my career, when I got my master's degree, I focused on adolescent pregnancy and the healthcare associated with our adolescent population. And then I went on and decided to further my education and got my master's degree and taught women's health, because at that time I thought everybody should love women's health as much as I did. And then I started hearing more about poor healthcare outcomes in Black women. At that time, it was just one of those things that the alarm wasn't really sounding at the time, but I was aware of it. And I went on and furthered my education again, even though I said I would never, but I got my PhD in nursing, and I really had the opportunity then to focus my research in maternal health. And at that time, the alarms were sounding everywhere. There was an opportunity for me to do some research in a few rural towns in Texas to see why, especially in those areas, there was such a high maternal mortality rate. But the research that I got to do at that time was where I actually got to talk to women who were pregnant to see how they felt about their pregnancy, how they felt about their health care. And it was just an absolutely eye-opening experience.
Can you say more about that?
It was eye-opening because one thing that really resonated with all the women that we spoke to was the fear that they had associated with bringing a male child into the world today.
Interesting.
And I did not expect to really hear that.
Yes.
And so that made me think that Black women are already stressed about their child being taken care of and being safe and protecting them before they even deliver the baby. So the stress that they may have during their pregnancy is already, manifesting, and what does that do to their body? What does that do to their mental health? And so to hear those women say, I'm worried for my child. I want to make sure that they're not killed. And, there were some incidents with Black men and police officers that they were actually thinking about when they were pregnant and their child wasn't even born yet. And so that was really eye-opening, just, the fear that they had associated for their child during that pregnancy. And the great thing about that research that I was able to do was some of the research that you'll see is they're doing chart reviews, they're looking at lab, they're looking at just everything that's kind of on paper for the patient that has passed away, kind of like what could have happened, what was that cascade of events, and just looking at the documentation.
Right.
Which is good, but it's too late for the patient that has died. And so we really wanted, my team and I really wanted to talk to women in that moment also to see, what are you seeing as a pregnant woman while you're, getting your prenatal care? What is it that you're seeing? And the other thing besides the fear was not being heard. Mm-hmm. And a lot of patients I interviewed said they just felt like a number. They just felt, like a cattle herd just being herded through, and you go through the motions, and that they just did not feel the connection with their healthcare provider that they wanted to have. And so those two things really sat with me, and I thought, what is it that we can do to make sure that people understand the severity of this issue, this pressing issue in the United States of America right now?
Well, you're really dealing with this at a good time, because I know diversity, equity, and inclusion is getting a lot of support as a concept. In certain states, it's verboten. Yeah. We won't talk about that, but it does have a lot of support in the healthcare field now, is how do we manage diversity and equity and inclusion so that everybody gets the same level of care. I'm wondering, you mentioned before teen pregnancy. Is there a lot of teen pregnancy among the African-American community that has an effect on poor outcomes because the kids are too young, or they don't know, or they're not educated? Does that contribute to part of the statistics?
So I really think that teen pregnancy, once again, is just, it is really, you're not going to see a huge difference between your African-American teens and your teen pregnancy. We want to educate all of our teens who are pregnant, sure, because that is such a big change for them, their body, trying to understand exactly what is going on. When it comes to African-American maternal morbidity and mortality, you're seeing it more in your population in your women who are in their late 20s to their early 40s, in that 30 area.
I'm glad you're bringing us facts here and disavowing some of the rumors or prejudices that so many of us have. So let me ask another question. You just talked about research. Is there enough funding for research in this area? Is more needed? Who are the funders, if you know?
There's more funding than there has been in the past, because there really is, people are really, I think it's finally in the light, this issue. And so, yes, there's National Institute of Health has grants. There are several, if you're looking for grants specific for Black maternal health, mm-hmm, there are several grants out there. One area right now is AI is everywhere. Everybody is trying to see exactly what AI can do to help, or some people are very concerned that AI is going to take over the world. But there's also grant money out there to see what we can use AI for in maternal health outcomes, kind of looking through all of your medical records, trying to see any kind of correlations, and trying to see if there's anything that we have not been able to see in those large data sets. And so there's definitely money out there as well. And so now you'll see that your data scientists and your healthcare providers are working together to try to see, what else is out there for us to figure out so we can have some better healthcare outcomes associated with Black maternal health.
That was great to hear. Thank you for sharing that. Are you hopeful, Dr. Norman? What's your sense about how we are handling this whole crisis? Are you hopeful about it? Do you see positive signs? Do you see improvements? How much of a crisis are we really in, I guess is my question.
Well, we are definitely in a serious crisis. When you look at the data, it has not been trending in a positive way.
Mm-hmm.
And so it's definitely a crisis. I think that we are moving in the right direction because, you have policy changes that we're trying to make. I don't know if you're aware of the Momnibus. There are 13 policies within Momnibus trying to just make sure that people are truly aware that we're making changes as well, right? So we don't want to just sound the alarm and then not do anything about it. We're trying to make sure that we have real impact for women, in healthcare. And so I feel very positive about it, but just know that it takes more than just Black women to make this change. We need everybody to understand the crisis and understand that this should not occur. There should not be such a huge inequity in care to where in 2024 we still have women dying in childbirth. We have rates that are worse than some third world countries. And with our healthcare system that we have, this should not be such a huge issue in the United States of America. It just should not be. Honestly, it shouldn't be anywhere in the world in this day and age, but really with our healthcare system and how we have the improvements and the strides that we have made towards trying to make sure that, we have healthy patients. It shouldn't be occurring.
So, Dr. Norman, tell me more about Momnibus, because I think most of us don't know very much about it. What is it? And you mentioned 13 points. Can you give us a couple of examples?
Yeah, so Momnibus is specifically a Black Maternal Health Act with 13 different policies associated with it. Policies to increase WIC, policies that are specific to like the social determinants of health, but there are very specific policies that we want to put in place to make sure that there are strategic changes and action that actually happens to improve healthcare outcomes for Black women.
Right. So, Jamil, you mentioned earlier about the beginning of your career and the inspiration that you had. Can you tell us, have you made some big leaps forward or had some huge inspirations later on in your career that have led you to the kind of work that
Your time and expertise are valuable, making focus one of the most important resources to have at work. These days, professionals spend nearly half the work week on written communication, and it can be difficult to stay on task with all the emails and documents you have to get through. With Grammarly as your AI writing partner, you can stay focused and quickly get through your work with relevant real-time suggestions wherever you write. It works across 500,000 apps and websites, so it can help with everything, from brainstorming presentation ideas to sounding more confident and persuasive in emails and reports. For 15 years, Grammarly has offered best-in-class communication support and enterprise-grade security on a business model that doesn't sell your data. 93% of professionals report that Grammarly helps them get more work done. Download Grammarly for free at grammarly.com/podcast. That's GRAMMARLY.com/podcast.
you're doing?
Yes, so I actually have the opportunity, like I said before, to really get into my research on Black maternal health. And then at that time, I had a previous student who was graduated. She was, living her life as a nurse, just got married, was pregnant, brilliant, very intelligent student, young student. And when she went in to have her baby, there were complications. and my student passed away,
Oh,
and her child passed away.
oh,
And so that really made me, it just brought it all home that I thought, wow, my brilliant student who is highly educated, who's a nurse, who knows everything about her body, who was doing all the things right.
hmm
What happened? Why did
yeah,
she pass away? Why did her baby pass away? What is going on? And that really just reignited me, and the passion that I have for maternal health was when one of my precious students passed away from something that, I was researching at the time. And it just really made me go, we've got to figure this out. It just should not be happening.
yeah. So close to you, so close to your heart. All the admiration you have, the expectation for the future, and then to have that dash must be so difficult to have dealt with and still deal with. But I'm glad it's kind of spurred you and motivated you to move forward with the kind of work you're doing.
Right. Yeah.
So we've been talking with Dr. Jamil Norman, PhD, RN, and CNE. She's a certified nurse educator. She's the Associate Dean of the BSN program at Walden University. She is participating in an important Black Maternal Health Week this coming April 15th through 19th, 2024. You can participate in the activities at this link. It's a bit.ly link. It's bit.ly, that's bit.ly/blackmomhealth, bit.ly/blackmomhealth. And if you want to communicate with Dr. Norman directly, you can email her at Jamil, that's Jamil, Jamil.Norman at mail.waldenu.edu. So this has been Jonathan Marks with Go to Health. Stay with us. We've got one more segment coming up, and we'll be talking about how you can participate in the Black Maternal Health Week, how you can stay more active with getting knowledge about Black maternal health and help us to address this maternal health crisis. We'll be back in just a few minutes with next steps you can take to help.
For more than 50 years, National University has been a military-friendly, yellow ribbon school that understands the importance of honor and commitment. With 4 and 8-week classes available, year-round enrollment, and more than 190 programs to choose from, we help veterans just like you define the next chapter of their careers. Learn more at nu.edu. That's nu.edu.